Okay, so while we wait for additional folks to come in, just get started with a few housekeeping things. So as usual, again, mute your mic, your camera, unless you'd like to chime in later on during the Q&A, and we will give you plenty of time to do Q&A. You can also post your questions into the chat as we go along, and we will be sure to tend to your questions as well. And please know that this session is being recorded and you are thus on public record. So I would like to welcome all of you on this most beautiful Vermont spring day. My name is Jeanette Schaefer. I am the Assistant State Librarian for Library Advancement. And we're so pleased to have Secretary Kurrle from the Vermont Agency of Commerce and Community Development, ACCD, Dr. Holmes from the UVM College of Medicine, and Christie Vallencourt from the Vermont Department of Health join us today to talk about the Vermont Forward Plan and what the plan might mean for libraries. And we talked a little bit earlier about this plan being kind of in transition, so hopefully Secretary Kurrle can speak to that too. So before we get started, I would like to acknowledge that all of you and your colleagues in Vermont libraries have made it through the last year and a half with creativity and empathy and resolve, and you've continued to provide access to resources and connectivity and entertainment when it was most needed. You've done a lot of pivoting to adjust to the guidelines as they came out. You've spent hours coming up with new service models to keep things going. You've been cleaning, communicating, becoming HVAC experts, and the list goes on and on. So I just want to acknowledge that you are just a driver in our communities, and staying open and keeping things going was so important to everybody staying relatively sane in this time of COVID. So now we're looking at moving forward again and getting back to what might be a new normal. And hopefully our guests today can provide some answers and some reassurance as you step into what that might look like for you and your local communities. So I'd like to hand it off to Secretary Kurrle. Thank you.
Thank you, Jeanette. It is so great to be here with all of you today. This is a special treat for me to be joining you and to have the opportunity to talk with you about the Vermont Forward Plan. So for those of you, many of you that I've never met, my name is Lindsay Kurrle. I'm the Secretary of Commerce and Community Development. And normally it is my job to promote our state and to do all things that will encourage economic and community development. And when the crisis became apparent in our state, I had to do a 180, and I was asked to ask people to stay home, kindly stay away from Vermont if you're not from Vermont for a while, and ask businesses to suspend their in-person business operations. It's really, really difficult. Many of you, all of you were impacted by that as well. It's been hard, but I want to echo Jeanette's comments and say thank you to all of you for all the effort that you've put into this and trying to keep Vermonters healthy and safe throughout this pandemic. We're really fortunate that Vermonters stepped up in so many ways. And I know libraries were incredibly important in a variety of ways, technical assistance, just being there, a place to help people out and get, as Jeanette mentioned, HVAC. I didn't realize you had become HVAC experts, but I'm not at all surprised. This is what we just have done, right? So again, super grateful for all you've done. And to just explain a little bit about my role during COVID, you may have heard me on the governor's press conferences a little bit. I have been instrumental in working with Dr. Levine, Dr. Kelso, folks from the Department of Public Safety, as well as a variety of state agencies on what we call the restart team. And so our job was to, once we had suspended the in-person business operations, to start developing guidelines so that people could safely open, sort of an an ease open slowly. So throughout the first months, we had no playbook. We were doing the best we could. We luckily reached out to a lot of experts, created some guidance. If we found the guidance just wasn't working, or we had COVID was spreading in a certain area where we hadn't anticipated it would happen, we had to pivot and readjust. And we did that, and feel really good about what we have accomplished over the last year and a half. So in March, when we knew things were starting to get better, the vaccine was starting to come in, the supply was improving, we were encouraged by many Vermont businesses to provide a roadmap for reopening. So that is where Vermont Forward began. So the idea of Vermont Forward was to arguably simplify all that guidance. So we had about 35 pages on our website of different sets of guidance, which, as you all may know, started to get a little bit confusing, or maybe a lot confusing, I'll just admit. So we really wanted to simplify things and say to folks, based on what we've learned over the last year and a half, these are the tools that we must do right now to continue to work our way out of this. And the Vermont Forward Plan was tied very specifically to vaccine milestones. And we had 4 steps in that plan, and we're in step 3 right now. And so step 3 is pretty, there's not a lot of restrictions at this point. Basically, step 3 was 60 to 70% of all Vermonters would have at least received 1 dose of the vaccine. And at that point, we revised our cross-state travel, which meant that you no longer had to quarantine or test to do domestic travel. And that was really big for a lot of people. We rely heavily on the region, but again, we wanted to protect ourselves. So that's why we had those policies in place. But when we got to that threshold of vaccination, we felt that it would be safe to remove some of those travel restrictions. We also, at that point, permitted more gathering and events. So again, we had a lot of businesses in Vermont who rely on gatherings and events, and or even families that were missing, celebrating that graduation or that wedding or whatever it might be. So we opened that up a little bit, and we, for a while, we continued to have a mandate on masking and physical distancing. Well, somewhere in I think it was June 1st, again, based on the science and encouragement from the medical team, we were able to say, if you're fully vaccinated, you no longer have to remain distant and wear a mask. So that, a lot of people really welcomed that. And a lot of people were also a little bit anxious. It felt like it, came quick and people weren't quite prepared. So again, like we've done all through this crisis, we worked through that, and we said, listen, if businesses want to continue to require those things, please respect that. Please follow their lead for right now. We'll all get there. And so I think it's overall going very well. So currently, right now, we're operating in what I would call, so libraries should be operating under universal guidance. So when I was talking about simplifying the guidance, we had all these different things to be thinking about, we boiled them down and said, there's 5 things you got to think about. Stay home if you're sick, wear a mask, ensure 6-foot spaces and avoid crowded spaces, practice good hygiene, and think before you travel. So those were like the 5 things that we said. Now, business owners, people operating businesses, you know your business better than anybody. So go ahead and use the tools we've learned over and used over the last year and a half to set your business operations, but make sure that you have those 5 things in mind when you make a plan. So again, it was a big pivot, but really what we were doing was we were trying to give people sort of this runway to work to the point where we have no more restrictions. Because again, we didn't want to just flip the switch. So hopefully businesses have been doing that. We've received some great questions. So it does tell me that people are dialed into that. But right now, so with the masks, the current posture is if you are fully vaccinated, then you do not need to wear a mask or stay 6 feet apart. However, unvaccinated people, right now, the mandate is that you are supposed to wear a mask in public spaces. The stay home if you're sick, again, that's just great health practice. Dr. Holmes is probably thinking, oh, great, she's playing a doctor here on TV, but I've listened a lot, and I think we probably can all agree that, in many ways, we've all stayed more healthy this year, outside of COVID, and it's because we have stayed home when we're sick and we're not passing things around. The 6-foot spaces and uncrowded spaces, again, this is really for those who are unvaccinated or at risk. We have required businesses to provide that space. And as we went into universal guidance, it got a little bit tricky because, some employers were saying, how do I know somebody's vaccinated or not, right? Do I ask them? And the reality is that at this point, we've said, if somebody is not wearing a mask, they're essentially signaling to you that they are fully vaccinated. If they are not, that is unfortunate, but we're putting trust in people to do the right thing. And if you and your employees are vaccinated or protecting yourselves by staying 6 feet apart if you're not and wearing a mask, then we feel like there is protection there and people can operate safely. The practice good hygiene, again, really just making sure that the employees have easy and frequent access to soap and water and hand sanitizer, and cleaning bathrooms regularly, and shared vehicles, things like that. So again, it's just a really good practice to do, and shouldn't be too heavy of a lift because it's something we all should be doing anyway. And then the final was the think before you travel. And when I say it's really because our travel restrictions have changed drastically in the last couple of months, to where we don't require a negative test before you arrive in Vermont, or before you before you arrive back in Vermont if you've traveled, or for others that are coming to Vermont, coming from outside the state. However, for foreign travel, you still should check the Department of Health, the website, because I do believe that there are still some restrictions about negative tests, even for vaccinated vaccinated travelers at this point. So that's what we have here today. But as many of you may know, the governor has said that when we hit 80% vaccine status for at least first dose for Vermonters, that he will lift the restrictions, or if July 4th arrives. So whichever one comes first. So we're looking at, I think, approximately 2,000 more Vermonters that need to be vaccinated for us to hit that goal. So that could happen as soon as this weekend. It really depends on, it could trickle in the next couple of weeks, or we could get a nice burst of people who have decided to go ahead and get that vaccine. So people, again, I think some people are really welcoming this. They're really ready to ease the restrictions and be done. And I would say that at this point, the change shouldn't be too significant because there's a lot that's being permitted at this point. There are certain sectors that will definitely feel an improvement. For example, restaurants, if they still have to provide, 6 feet of space between parties because they don't know if, necessarily one party is vaccinated or one's not, they still can't be arguably at 100% capacity. So there's certain sectors that are really going to feel the lift. I'm not sure in the libraries whether you will. I'm guessing it's not going to be all that different in terms of like the spacing, the occupancy. And at this point, again, once we lift the restrictions, there will not be a mandate for the masking. There would be it would be encouraged for unvaccinated people. Again, you don't have to check all the people that come into the library or even your employees to verify if somebody has chosen not to wear a mask. They're essentially signaling to you that they are fully vaccinated. So also, when we get to this next step, this final step, there will be no limits on gatherings and events. And as far as the universal guidance, right now we're saying encourage, but honestly, really what it is, it's that reminder that I just said, those really good practices about the hygiene and just staying home if you're sick. But again, our mask mandates, distancing mandates, those will be going away. So I know I've given sort of a lot of information, and I'm not sure what you're most interested in, but when it's time for the Q&A, I'm happy to answer specific questions related to your sector and things that are on your mind. With that, I will turn it over. I don't know if, Jeanette, back to you.
Yeah, thank you so much. It was helpful to also hear about specific library advice too. So, Dr. Holmes, we're happy to have you talk about uh, things as they apply to children next, because I know our libraries are going to do a lot of summer programming, as they always do. And this year, I think a lot of that will be happening outside. So if we really enjoyed your presentation that you gave to the summer counts folks, I think it was, and thought that it might be helpful for folks to hear from you in the library world as well. So take it away.
Okay, thanks everyone. I think I'm on camera now.
Yep,
Hi,
and let
good
me spotlight
afternoon.
you.
I have a few slides just to ground us in some of the pieces. It's good order to follow Secretary Kurrle because she's got all the facts on where we are and what's ahead. But can you see my slides?
Not yet.
Okay, so that didn't work. Let's try that again. So share options, share.
Yep. And then you want to share window, the window that you have your presentation open in. And I have to say, we've just had a Teams update, and we're seeing a few functions that are new and others that are not. Oh,
How's
wait,
that?
there we go. Okay,
All
thank you.
right. Yeah, this
Perfect.
is, it's funny how just when you get comfy, right? Oh no. Are you still there?
Yes, and we
Oh,
can see
yeah.
your slides too, and you
Okay,
had
because I
them in.
just shrunk down. Okay, here we go.
Okay.
So hi everyone. It was fun to hear Jeanette introduce me as at the College of Medicine. I still have 1 week left as the physician advisor to the Maternal and Child Health Division at the Health Department. I made a pact with Commissioner Levine that I would stay in this role until schools closed, which is next Friday. On average, every school district is a little different. And then I have been doing a dual role in the College of Medicine at the Department of Pediatrics, doing some quality improvement, but I have no intention of leaving any of my great colleagues in this space of providing opportunities for joy for children. And your space for Summer Library is, I'm loaded with gratitude. So I just wanted to start by saying, it's been extraordinary what you've had to grapple with in the last 14, 15 months as people who work in public spaces. I also want to just add there's always extra complexity when we're working with children because until this fall, we won't have vaccinated children under age 12. And I want to keep making the shift with you. As Secretary Kurrle said, we're about to step out of the government mandates and the sort of turning toward big buckets of guidance, and we're going to turn toward really pediatric advice and best practice. So that's my goal today. So I didn't realize Secretary Kurrle would talk about Vermont Forward so much, so we can blow through that. I threw in a few slides about vaccines, and then I wanted to just look at some of the guidance on the care of children, recognizing it's the guidance will officially go away when we hit that magical 80%. And I hope there's lots of time for questions at the end. So I'm sure you found this website by now. I check it every day, but this was a very well thought out epidemiologic decision tracing back to March and April about how we were going to move through increasing the percentage of Vermonters getting vaccinated and starting to loosen the restrictions as it relates to gathering, mass, and distance. And you can tell from following the data that it has been the right approach, entirely successful, and the scientific colleagues of mine were just so grateful for the way Vermont has proceeded in this transition. But I do want to acknowledge, as people, we have a lot of psychology here, and we're having to march across a divide because we spent so many months with these rules and with this these mandates. So if you're struggling with the idea that you're going to be in, as a vaccinated person, you're going to be unmasked, wandering about, I'm with you. And I stopped trying to prognosticate when we're going to hit 80, and it was funny to hear Secretary Kurrle say it could be, several more days. I'm guessing it's over the weekend, and because I'm really hopeful that we don't have to keep parsing in the next few weeks as schools close and summer programs start. I want to throw up a little data to show you that we track school-age children data really just since September when schools opened, and we did this by how many cases per 10,000, which is not our normal way, but it was a good number to show graphically. And when you look at the age groups, these are 5 to 18. So the gray bar is the rest of Vermonters. So you could see in April we had quite a peak, 280 per 10,000. And then because of the vaccine and dropped cases in our communities, we have seen a nice slow decrease, and we're down to just 19 last week per 10,000. We also track this by the littlest, 5 to 10. Middle school kids 11, 13, and then the high school 14 to 18. And boy, did we have a peak back in April. And that was before children were eligible for the vaccine. And it was also when we could see the fatigue hit our wonderful families and hit communities. We had some high school athletics occurring and a lot of cases. And they have, because of the vaccine, and also I think people getting a little bit back on track with some of their behaviors, we headed back toward these very low rates in the past, all the way through May and into June. Okay, so in the old days, it sounds like many of you have heard me speak, we would lead with this slide. We had 9 areas that we needed to continue to address and provide guidance as state leaders about health screening and travel, what to do in returning to work if you have symptoms of the vaccine, what to do about transporting children, buses, cars, vans, the drop-up and pickup routines, hand hygiene, masks, cleaning, physical distancing in pods, and volunteers. This to me is a historic slide now because none of this is going to be addressed within this week. This is all going away. So what I did was I kept it here for us to just pause together of where we've been and how hard we've all worked, and to acknowledge that some of these routines need to stay for the reasons Secretary Kurrle described. This is about good old-fashioned infectious disease protocols, and I sure do hope we don't backslide just because there aren't mandates or massive guidance documents on websites. So staying home when you're sick, as Secretary Kurrle said, it's paramount. But I have to acknowledge, as a person that works in the child health space, we do not have the right public policies to support families to stay home when their kids are sick. So we are creating this unmanageable situation for our families, because you can't have kids running around with runny noses and cough even without COVID. It wasn't good practice, but all of us that have raised children know we don't always have choice. So I just want to live together in that space, because I think as a society we need to care more about that, and paid sick leave would be a really good start. If you are with a child in your settings and they look sick, you do have it's not prohibited that you would sit and put some protocols in place, ask the child to sit off to the side and wait to be picked up, so that you're not in any responsibility place as it relates to that child's illness. So here's the mass story. Secretary Kurrle already said this, but I'm going to add our pediatric colleagues, my pediatric colleagues, are putting out a statement today from the American Academy of Pediatrics. And it's going to say that pediatricians strongly recommend masks indoors for everyone who's unvaccinated. And that's children who aren't eligible and also staff who are choosing not to be vaccinated. And I say staff meaning people that work with children, but no one needs a mask outside. And this will be at that magic 80% mark. So this is different than the word encourage. And I don't know if you guys have been tracking for the last year the verbs that we use, but Encourage is fine for the general public, but pediatricians are very clear that this has to be a strong recommendation. Nobody wants unvaccinated people unmasked indoors. So I think that's cool. I think Vermont is able to manage this, that it's pediatric health advice now, it's not government advice. And then I did want you to know that we have shifted the data tracking, that we're also going to look at 0 to 5. So those school age numbers I showed you earlier, we're now starting next week going to have data that takes us through the whole childhood experience, recognizing that unvaccinated children are still at risk. And then the cleaning piece, I just have to always remind ourselves where we were. My goodness, in the beginning, we thought this virus was spread on surfaces. And the libraries, you were right in the center. We were quarantining books, recommending they not come back onto shelves for days. We had tons of protocols for, child serving settings, for wiping things down. We were wiping playgrounds. We were wiping the rungs of the ladder to the slide. And it all was studied greatly over the year by the CDC and others to show that the mode that we transmit this virus is through respiratory droplets, and it is time to return to regular cleaning surface protocols. This is not a disinfecting or a overly vigorous process. And I wonder if that is a big shift for you, because when I come in and out of grocery stores and stuff, I can feel the need to just wash my hands, which is great infectious disease prevention. But that sort of impulse to do it before, during, and after an experience, we really have to shift our psychology. Okay, I'm not going to spend a lot of time here because I think Christy's going to speak to this a bit too, but I did want you to know that as a scientist and a physician, I have never been more excited about anything in my career. These vaccines are the most effective and the most well-studied that we've ever had. And that's coming from a pediatrician who, obviously vaccines are a major part of pediatric healthcare. So if you're at all inclined scientifically, the idea that there are 3 different ways that we're going about this vaccine production just shows that we are a really evolved society. And I am happy to report that the studies and everything about these vaccines continues to show that it's safe to administer vaccines to children, and that if all goes according to plan, we're going to be able to approve vaccines for even younger children as early as September. That will likely be Pfizer that will apply for the emergency use authorization. Sometimes people think it's going to be the 5 years and up, and others are wondering if the studies in the 2 years and up will be available for the emergency authorization. I'm going to skip these for the sake of time, but suffice it to say that the neutral scientific, nothing to do with government people in my world that study vaccines are just giddy with delight with the effectiveness of these vaccines. So even if you come in contact with the virus after you've had the vaccine, it's absolutely unheard of that you would get sick or go to the hospital or have death. And then following how long we're immune after vaccination is just also of great interest to all of us, but it's looking very good that it's at least a year. There are people who have been vaccinated in the studies and the clinical trials in September of 2020, and they still have the same amount of immunity as when they were first vaccinated, and now it's June. And then just a few things about the effectiveness. I don't like pitting these vaccines against each other. They're all effective. They were all studied a little bit differently based on the variants circulating. So it's important to not feel that there's any, that you're supposed to be picking or choosing. I will say, as a child health person, though, remember Pfizer's the only one approved under 18. And then my favorite quote about the CDC is, "This is the most intensive safety monitoring in the US history as it relates to vaccines." So I hope you have a trusted health professional in your life if you are wondering still about whether you should receive a vaccine, or if you have children in your life, I hope you're having conversations with your pediatrician. And a little bit about side effects, which we all know. Side effects are a sign the vaccine is causing an immune response, which is exactly what we want. And the vaccines are free. if you have any inkling in your communities that there's some cost sharing or cost associated with a vaccine, please let me know. And the health department, such heroes in all of this. This vaccine rollout as a state is award-winning and the best in the country, and it's so easy. So healthvermont.gov, my vaccine, and I'm all done. Back to you, Jeanette.
Okay, thank you so much. And you've given me a perfect segue to introduce Christy, one of the heroes behind all of this great communication and the wonderful visuals and marketing materials. And even, I mean, we had a COVID vaccine brand going on, and we still do. So many of you out in the library world have asked how you can help get the word out about vaccines. And we had been working with the Department of Health on some marketing efforts and thought this was a great opportunity to have Christy come in and tell you if you are willing to help spread the word, how you can do that. So Christy, take it away.
Thank you, Jeanette. Hi, everybody. I'm so happy to be here. Thanks for the invitation. I'm going to take you through a vaccine partner toolkit that we have. We started this last year, and then we've had several iterations of it, and it just kind of morphs as the different messaging changes. So right now, we've shifted our focus towards one of, now this group is eligible, now that group is eligible for our partners to share, to instead a much more universal message that vaccines, it's never been easier to get vaccinated. So people who maybe aren't, ideologically opposed to getting vaccinated, but they're busy, they have competing priorities, maybe they don't have access to good internet or phone service, and the whole thing just feels very overwhelming trying to make an appointment and navigate that online system. Now is their time to get vaccinated because many vaccine clinics don't even require appointments at this point. So I'm just going to show you the Google Drive just to poke around in it for a few minutes and kind of show you basically what's offered there. And then I'll drop a link in the chat to the Google Drive. And I just invite you all to take a look on your own time. And if there's something there that interests you and you think might be useful for you to share with within your library or your constituents, then we would be very grateful. All right. Here we go. Screen sharing. Oh, this is like different looking than it used to look. Okay. All right, everybody, sorry. I'm gonna go to this. You guys see, Jeanette, can you give me a thumbs up if you see the Google Drive? Okay, wonderful. Yes. Teams has to go and update on us without telling us all these weird ways we're just gonna look. Okay, anyway, so here's our digital toolkit. You can see it's not fancy, that was intentional. Hopefully you all have access to Google, right? I know UVM has some issues accessing Google Drive, but hopefully that's not the same for you guys. You do not need a Gmail address to access this. It's just anybody with the link can come to this page and then peruse and download whatever is useful. So I'll show you the posters to start because that's kind of the most complete message. And if you're interested in sharing something, might be the most useful to put up in the library. So we have two versions right now. We have a blue version. Actually, we have three versions right now. We have a blue version, white version, and a customizable one. I'll show you what this one looks like. We have one that goes, this one is if you want to print right to the edge. Like if you have the ability to get it professionally printed and get it trimmed down, this is one you'd use. We also have the one in the same folder that allows for a margin of space, so you can print it on any printer, including one you may have in the library. So let me just make this a little smaller. No, it's not going to let me make it smaller. Anyway, you can see that there's this continuing, if you've seen any of their other COVID vaccination materials, you'll see there's a continuing theme, a continuing look and feel, and that's intentional. We want to have this look kind of associated with Vermont's vaccination progress. And this one is to find a walk-in location near you. And this one is really just saying, you know, tooting our own horn, we're really doing a good job, because we are. We're doing the best job in the country. And then this one gets to that. It's never been easier to get vaccinated, and clinics are conveniently located around the state. So if you haven't done so yet and you're interested, please check out healthvermont.gov/myvaccine, and you'll be able to see all the walk-in clinics listed, as well as some people may still prefer to have an appointment, and we think that's fine and great. So there's still an opportunity to do that. They can do that through the Department of Health and our portal, or they can do it, you know, directly through certain pharmacies. So those are the posters. The customizable poster, I want to show you this because this is newer. This is actually, once you download this, you can open it in Adobe on your computer, and you'll see form fields. So if a library, let's say, was ever to host a walk-in vaccine event, and you wanted to do some promotion and wanted to use this brand, you could do that and also have the option of customizing you could do your own logo on the side and any event details. So we have a few things like that that are customizable now, specific to promoting these walk-in clinics. Or maybe it's not the library that's hosting it, but there's one in your community, and you just want to help spread the word. That's another option too. I won't take you through all of this because I do think that it's, you know, something that's just best for you to take a look at and see what's here and see what you're interested in and what could be useful. But I will say that the newsletter post is more about vaccines, and it speaks to not only how safe and effective they are, but also dispels some common misperceptions that they were they came out too fast, that they haven't been thoroughly tested, without repeating those those myths or misperceptions. It's addressing things that we hear often of that, or, you know, why somebody might still be on the fence at this point. If you have social media and you're looking for content, I know at the health department, we're always looking for good content. So sometimes, you know, people like this, having these editorial calendars. You'll find lots of social media graphics to choose from with recommended post text. And these are very specific to both normalizing vaccinations in Vermont, that most people are getting vaccinated or have gotten vaccinated. And also, again, dispelling some really pervasive myths, like that people can get COVID from the vaccine itself. So you can take a look at these on your own time, and feel free to use any of these. And if you have any questions on how to use these materials, or if you're having any issues with any of these files, you can always reach out to me. You can email me, and I'm happy to help. I think that's it, because I know we want to leave enough time at the end. So thank you for giving me this time on the agenda, and I will put the link in the chat.
Great. Thank you, Christy.
Thanks.
The other thing is we have ordered a bunch of these pre-printed already from the Department of Health, and you can request them through us. Just we don't have them all available. We've made sort of a pre-selection of things that you can request through a form, and Jennifer will send those out to you. We have a limited number, and Jennifer, if you could post that in the chat as well, I would appreciate it. And shout out also to Jennifer Johnson, who is in the Department of Libraries, who is doing a lot of this work in promoting vaccines, and she promoted mask wearing as well. So I think we have a few questions that we can already start with in the chat, and we'll give folks who are calling in an opportunity to also speak and ask their questions if they have them. So the first question is from Julie, and I'll let you presenters just choose whoever might be the best person to answer them. So Julie says, being in a resort area, how are we to handle visitors coming into our libraries who do not fall under the 80% of Vermonters who are vaccinated?
Would you like me to take a stab, Breena?
Yeah, and then I will
Okay,
as well, but
so
you go
I'm
first.
going to answer, from our business, what our business guidance perspective would be. So again, in the library, if you post signs and want to recommend, you have the right to either require masks, or if you want to recommend it, put a sign up and say, if you're unvaccinated, please wear a mask. And then again, if people choose to come in and they're not honest about it, if you're protected, your employees, your library staff are protected by either being vaccinated or wearing their own masks and staying 6 feet apart, it should be fine. But I would, again, from a health perspective, see what Dr. Holmes has to say on that.
No, that's exactly it. So, vast majority of people are vaccinated, low community case counts, even in out-of-state visitors. Set up the policies as a business that make you comfortable and your staff comfortable, but the risk is extremely low. And, again, encourage vaccination of your staff. I'm sure you have a lot of employment law about all of that, but I just, as a health person, I keep reminding the safest thing we can do is get vaccinated, and then the rest of the health behaviors of the people around us become less and less important.
Thank you. And then we have 3 questions about masking outside. So the questions are, so did they understand correctly? No masks outside, even if not distanced, and no masks for children outside if children are not vaccinated.
Yeah, so remember too, this is after we get to 80%. So
yes,
I think Secretary Kurrle and I probably accepted this invitation hoping we would be there today. It's so much simpler to talk in the present instead of what's coming. But so that being said, when you hear the threshold has been reached, nobody's masking outside. And the scientists are super happy with this. Being outside has turned out to be a very important part of COVID prevention. So we've never distanced with little kids. So let me just be clear that there were a lot of recommendations and we really worked on distance. It's definitely one of the strategies. But when it came to the care of children, we just couldn't do it. And we did really well and the case counts were low. And so, yes, we're not going to set this up with all sorts of parameters from pediatric healthcare. Again, this is the government, the way I describe this over and over, you've heard me say this before. COVID was a triangle of common sense, science, and politics, and the political piece is coming out. No more government involvement. So you have science and common sense. So if 30 people are lying on top of each other and none of them are vaccinated, then yeah, I would say you should distance, but you're not going to have posters about it and you're not going to have any place to point to. That's just the way I talk about that. And then, yes, if, when we get to this magic place, we're not going to be recommending anything about distance. And we are going to strongly recommend masking for unvaccinated people indoors as pediatricians, not as state government.
Okay, that is helpful. So we have 2 questions right now about cleaning surfaces. So one of them is, so no need to wipe down computer keyboards after each person using it. And the other one is, how often should a public library clean the bathroom, and it is safe for staff to clean public bathrooms? You talked about surface transmission earlier.
So this is where we need to shift back to sort of what are the guidelines? What was best practice before COVID that maybe we didn't quite do because it didn't make sense from a societal, we just weren't that worried about it, and maybe we are now. So forget COVID. We've had the healthiest winter in the pediatric world that anyone in Vermont in the last 30 years remembers. So until recently, they had put no one on a ventilator, no pediatric patient for other respiratory viruses. So usually in the winter, we have RSV, rhinovirus. We had a really healthy winter. So I kind of like the practice of wiping down keyboards in between use, but it's not some mandate anymore, and it's not some strict policy. It's, if you have a kid using a keyboard and then the next person comes along, give it a quick wipe, or not, but then maybe someone might get rhinovirus or a regular virus. And then in terms of the bathroom cleaning, I'm not the expert here. There must be some sort of general principles here, Secretary Kurrle. I don't know, but I do know the staff can go back to the cleaning. I didn't know that was a thing, but all of the guidance about that should return to normal.
I would agree with what you said. Yeah. I don't have
Thank
anything
you.
different.
Okay. Let me see. I think I know the answer to this, but is there any guidance for the amount of time patrons can be inside the library? A lot of libraries have restricted browsing and just had people come in just to, come in, do their transaction, come and leave again, or do computers for 30 minutes. I assume there's no guidance for that after. Okay.
No.
Okay. So here's a big one from Aaron. Aaron, I think we did answer your first question about masking. The second one is when inside. How can we best support our unvaccinated youth? Should I make sure my staff and volunteers, even if vaccinated, wear masks during children's programs? So we model this. How do we support those patrons who are nervous to participate with unvaccinated kids? Thank you so much.
Great. So this is such a great question, and this is about child development, pediatric healthcare, solidarity, modeling, and there's no answer. So we have a noon call with the pediatricians every Monday, Wednesday, Friday in Vermont since COVID, and half the pediatricians write into the chat, child care providers should keep their masks on even if they're vaccinated in solidarity with the 6-year-olds, and then the other half are like, oh, come on. There are so many things in our society that adults can do that kids can't. So how about saying to children, I'm so sorry, you're not eligible for the vaccine yet. You will be soon. And I'm able to take my mask off because I'm vaccinated. Nice teaching moment about the power of vaccines and science. So I'm good with that space, but you're welcome to think through the development of the children in front of you. So if there are kids that you're just like, I can't wear a mask and you're not wearing one, then say, I'll put one on. Let's do this together. It's more back to that child development. But the question about the participating with unvaccinated kids, I mean, if you're sticking with that vaccinated people are safe around unvaccinated people, that should be the reassurance. So that needs the science that the vaccines work. Even if you get the virus, you're not going to get sick and you're not going to transmit. So, but I still think there'll be nerves. And as I told you, we're all in a psychological shift here of when, you enter certain rooms now, I'm like, I'm just going to put the mask on. Like I'm just working it out personally. So I know you're working it out too. And then the last thing I'll say that's the most heartbreaking for me so far, what about youth who want the vaccine, but their parents have chosen that for them as their healthcare decision makers, they're not getting it. So we are hearing some sad stories in middle school that kids have stickers on their phones, I got my vaccine, and it's become a badge, and other kids are saying, I don't get the sticker because my mother doesn't want me to be vaccinated right now. And so we're entering into that stuff that requires a lot of loving care, that requires accepting each other's place and in all of this without judgment and wondering where the opportunities for conversation are rather than thinking this kid's unvaccinated because, somebody's a jerk. It's just because kids always get put in that nexus of their decisions are not their own when it comes to healthcare. So that was not a question, but I imagine you're going to run into that this summer.
Yeah, it's very helpful to hear. So there are 2 questions about step 4 and the special guidance for childcare and day camps. Will they move to universal guidance? Okay.
Yes.
And indoors
no
as well.
guidance.
No
Yeah.
guidance.
But so like this word guidance I've learned so much from ACCD too. This has been a really fun year on that level. No guidance, but best practice, pediatric health advice, CDC, there's still resources for you. It's just you're not going to have a state government document to go find on the website. And so my AAP, American Academy of Pediatrics colleagues are awesome, and they really are putting out a press statement this afternoon because they didn't want to do it Friday because we think that the 80% might be Monday, and it's going to outline for you this whole thing about your pediatrician is an expert and a person in your community that you can really talk through some of the nuance here with but there's nowhere for you to go anymore on the state website after the 80%. And that's going to be confusing. I think for schools with their, we're lucky they're closing down for the season, and then we're going to have a lot of dialogue in August because some school leaders are going to say, give me something, I need something. And I think the Agency of Education is going to say, there's nothing, just go to school. Yeah. So you guys are stuck in the middle here as summer people, which we want because kids need this joyful, exciting experience. And, without guidance, you're going to have questions, and we're going to hope that pediatricians can help you.
Yeah, that will be really wonderful. And we will share that when it comes out. And Dr. Holmes, if you wouldn't mind sending that to us when it does come out, if you could.
Absolutely.
Thank you. We'll pass that on. Anything will help, I think, just try to find a path without without the guidance, as you say. There is a question about let me see, summer guidance, galas in buildings with bands and dancing. Same, right?
Yeah.
Have a gala, dance.
Dance. Go to, we're trying to find, there are some cool websites about, music and singing and unvaccinated, but just put some common sense in here about what do you know about the people that you're with. If it's a big mystery of people's vaccine status, you don't want to snuggle in indoors and start singing in each other's faces, So it's all there for us, but it does require a little bit of cognitive function here, thinking through the situation rather than try to go find a document to line up with your activity.
Yeah. There is a question, if a vaccinated person does get COVID, what is the likelihood of them passing it on to an unvaccinated person?
Extremely low. A little bit hard to quantify right now because it's been such a rare event for a vaccinated person to get COVID, but we're tracking it. It's happened. It's happened in Vermont. It's happened all around the country. The CDC has a tracking device for that. There's a reporting structure for that, and we're studying those people, but it is the last time I looked, those people were not transmitting the virus even if they tested positive with any efficiency, as we say.
Great, thank you. And Marie asks, singing at story time, and Abby answers, if you want to sing outside, which is great, and don't snuggle while you're singing. That's another really good bit of advice. I love that. So I want to just give the folks that are calling in an opportunity to ask questions. And in the meantime, Joy and Jonathan, if I'm missing anything in the text chat, if you could also just kind of spot that for me. So anybody on the phone who would like to unmute *6 and ask questions, or anybody who doesn't want to type but ask their questions, please go ahead and do that now. We have about 5 minutes.
I'm seeing a couple questions that are somewhat specific to me. I'm not sure if I'm keeping up with them, but one viewer said, Secretary Kurrle, when you were in North Macedonia, were you able to visit some libraries? And I was not able to visit some libraries. However, I did visit the university that they call the faculty, by the way. And they were very interested in workforce development and making sure that they were connected with businesses and knowing how to prepare their students for the in-demand jobs. And seeing your point about the libraries helping with workforce and community and economic development, I couldn't agree more. I'm so grateful that you see it that way too. And I know we probably should connect more and bolster our partnership in that area. So thank you for highlighting that. And happy again to take this offline. Feel free to reach out to me. I'd be happy to engage on that. Also, somebody was asking about hearing about some larger events from the ACCD perspective. So again, once we hit that 80%, and even now, so many events are already allowed, permitted. And again, unvaccinated people are mandated to wear masks. But once we hit the 80%, when we're specifically talking about, those that are a little bit older, again, I know with the children, if it's indoors, there's some different recommendations, but largely we're saying no restrictions on these events. You can have many people as you want, you can sing, you can dance. And just, you know, as a reminder, I'll put my little plug in is like when the governor lifts this emergency order, we're doing it because we feel that we are no longer in an emergency state and we have a much higher vaccination threshold than most places. I don't know, maybe there's somebody that's above us, but we feel that when we get there, we feel good about what we're doing. And I just want people to feel comfortable. You know, as I mentioned, if you want to sing and you want to dance, and I'm not the healthcare professional, but from a business and an event planning perspective, we are not restricting that.
And it sounds like maybe our mental health care professionals would want us to sing and dance. So let's take that in consideration too. Contact tracing, there will be no contact tracing. We don't need to do that, right? For
let me
events?
just,
Or
the word
after
contact
this?
tracing has gotten a little conflated, especially with childcare and schools. So if a staff or student contracts COVID in the, not student, child or youth in the summer, children are not great historians. If the child is 8 years old and they were at a library program, it would be helpful to the health department if you knew who was in the program. That's all. So it used to be called a line list, but we don't like that term anymore. So now it's sort of just a program list. And then the health department or our vendor, AM Trace, is going to pick that up, figure out, you know, who to consider a close contact. So we're still contact tracing over on the health department side, but in terms of your role in it, it's not nothing, because we would like you to at least know who was around. But if you can't, you can't. Like if it's a playground and there were kids that weren't part of the program, that's no harm there. But if you are running a program, presumably you know the 20 kids in the program, and we just want to know their names in the event of a case. So it's, again, shifting. You know, there will become a time when we're not contact tracing, but we're not there yet.
I'm glad to hear you clarify that too, because we get confusion with, you know, restaurants and folks who are saying, so we don't need to contact trace anymore. And I'm like, I think what they're meaning is, so we don't need to keep a log anymore, right?
That's
a customer
correct.
log, because the contact tracers, as you just mentioned, are, you know, through the health department. It still will happen as needed, but the actual logs are not required. But as you mentioned, it's helpful if
that's right. And what's interesting, that's totally true in restaurants. But with kids, it's a little trickier because you can't call an 8-year-old and say, who'd you have dinner with? You know, they don't remember who was anywhere. So people that work with children, we're just asking them to have rosters. That's the term. And you must have them anyway, right? You must have a roster because it's the care of children. It's not like you're like, I don't know, some kids showed up. I mean, maybe there are programs like that. I shouldn't be joking. But in general, if you're running a camp, you know who came to camp. That's all we need from you.
So it's for kids that come in just to be in the library day to day, we don't need rosters, but for kids that are part of a program, we're presumably going to have a roster anyway. We might as well hang on to that just in case.
Exactly.
Okay, that sounds good. And then we are almost out of time. Rosters even for outdoor events. Abby, it sounds like for kids, if you have them for programs, maybe keep them. So for Dr. Breena, as a doctor, you are very optimistic that all of these measures are sufficient to avoid another surge after more reopening?
Yeah, because I'm completely obsessed with this vaccine. I have never, I've been a pediatrician for 28 years. I have never seen anything like this. You know, measles vaccine, 88% effective. Always has breakthrough cases. I don't even want to tell you some of the other percentages because I don't want you to lose confidence in childhood vaccination. But this one, it's just, and it's such a beautiful mechanism to go, both of the mechanisms, to come in with the adenovirus and produce the spike protein, that's the Johnson & Johnson, or to go in with just a little piece of messenger RNA and then you make the protein. It's genius. And we've been doing messenger RNA research and science for decades. This is just the first time we've superimposed it onto vaccinology, and it's so safe because and everything just gets made into this protein that does not confer virus. It's just the tip, you know, that spike on that thing I showed. So you're developing immunity to a spike, not to a virus. It's genius.
It's
So yes,
great.
I feel great, but I'm also a data person, and I'm going to be watching the case counts like a hawk for 0 to 5-year-olds this summer, because they don't get sick. This is not a pediatric disease. It's the strangest thing. It is not a pediatric disease. That doesn't mean kids don't get sick, but it's really rare. So we're going to watch it, and if we start to see an uptick in cases in kids, we're going to have to ask what just happened and continue to sort it out. But we also never thought we'd get to 80%. I mean, yay, Vermont.
Yeah.
Like, yay, Vermont on every level. Like, yay, Vermont for the efforts to get the vaccine into people, but yay, Vermonters for stepping up. I mean, just amazing. So.
And that is actually a really nice way to end this meeting. We had one more question about temperature checks and for staff. We don't need to do that anymore. So I think we can end on the yay Vermonters.
Yay, Vermont.
And yay healthcare professionals and ACCD. You have just done the most amazing job to get us here. So thank you for your time and for coming and telling us about libraries and how what all of this means. And thank you everybody else for attending, and have a great summer that is filled with singing and dancing and fun.
Okay.
Thanks so much.
Thanks for all you do.